Did you know that you can suffer physical harm by doing absolutely nothing? Strange, isn't it? And yet, costing the NHS millions each year is a condition that only occurs when people are sat or lying in the same positions for long periods. I'm talking, of course, about pressure damage. Hi, I'm Jo. I've been a district nurse for over 7 years, and I'm running this crash course of 7 short videos to help us explore together how we can help you prevent pressure area occurrence. The videos are just 10 minutes long, and each one will assess a different area of pressure area prevention using a professional tool called the Asking tool. It's been adapted here so that you can use it at home. Many of you may not have heard of pressure damage, while others may have already experienced it. No matter your history, I promise there is something in these videos that you are able to take away and potentially reduce your risk of ever developing a pressure area. So, are you ready? Let's get started. Here we have the Asking tool, developed by NHS England and adapted here for you. In today's video, we'll be talking about assessing if you are at risk. The next video will be skin assessment, and after that we'll discuss surfaces and which are the most suitable for us to be sitting on. The K in this acronym is about the importance of keeping movement, where we'll discuss exercise. The I will discuss incontinence and toileting, and about reducing sweat when using pads. The N will be about nutrition, discussing whether you are eating well. And the G will simply be about where to get more information. In order to be able to assess whether you're at risk of pressure damage, it's important we have a base knowledge of what pressure damage is. I'll give a short explanation now, but if you'd like to access more information, there's some available via the QR code in the corner. There will also be a reference list at the end of today's video, so you know all this information will have come from a trustworthy source. So, what is pressure damage? Our circulatory system is magnificent. It feeds our bodies with blood, full of nutrients and oxygen via arteries, veins and capillaries. However, when this blood supply is cut off, the surrounding tissue will start to die. With pressure damage, the blood supply is cut off due to the area being squashed, usually between a surface such as a chair or bed and the weight of the person. As the tissue dies, it can first discolour and then break down, causing painful open areas. We call these pressure areas pressure ulcers, or sometimes bed sores. These ulcers, if left untreated, can become serious, leading to infection, and in some cases can get so deep that they reach bone. You may hear healthcare professionals talking about different grades or stages of pressure damage. This is our way of monitoring how deep the area is. There are three main factors to consider regarding the formation of pressure damage: the amount of weight pressing on the area, the amount of time that the blood is restricted to an area, and the individual factors of the person, such as other health conditions that may cause more rapid deterioration. Therefore, most interventions will focus on managing one or more of these areas. As you can imagine, some areas of the body are more prone to pressure damage than others. We call these bony prominences, where the bones are closer to the surface of the body. These include your heels, toes, sitting bones, elbows, shoulder blades, and more shown in the diagrams. Also, while no bone present, if you use glasses, oxygen tubes, or other medical devices, these can press down and cause pressure around soft tissue, such as the ears and area between your nostrils. Pressure areas can affect anyone at any time. In fact, they are so common that over 700,000 people develop them each year in the UK alone. However, there are certain risk factors that make it more likely that certain people will develop them. Hello there again. Well done. Learning about pressure damage was the first step in making sure that you don't develop a pressure area. As they say, knowledge is power. The next task of this video, and the last task we'll do today, is assessing whether you are at risk of pressure damage. This is where we focus specifically on you as an individual. Do you remember earlier when we were looking at the information, there were three main factors to consider regarding pressure damage. There was time, weight, and individual factors regarding a person. Assessing if you are at risk is about acknowledging those individual factors. What's going to happen now is I have a series of questions, there's about 10 of them, and I'm just going to ask if any apply to you. Just listen to them as we go along, they'll appear on the screen as well. And make a note if you think that any of these apply to your situation. Are you ready? Okay, let's begin. Do you have problems moving or changing position without help? Do you have reduced feelings of pain and other sensations in some parts or maybe all of your body? Do you have problems controlling your bladder or do you use continence pads? Are you unwell at the moment? Are you having an operation soon? Have you had a pressure ulcer before? Do you have a poor diet? Do you drink less water than you should? Do you have memory problems or problems understanding? Do you have an injury that affects how you move? If any of those questions apply to you, maybe you do have a poor diet or you do use continence pads, then your risk of developing a pressure damage is higher. The more of those questions that apply to you, the higher your risk will be. However, there is good news. You're doing this crash course, which means you've already started fighting back and you'll get the tools that you need to reduce that risk. If they didn't apply to you, that doesn't necessarily mean that you are not at risk. It was not an exhaustive list. Think carefully about your lifestyle, about how long you spend sitting in one position. Reflect on what we learned earlier and ask yourself if there is a time when a part of your body may be under more pressure than it should be. You may still be at risk. If still you think that definitely you are not at risk, still feel free to finish this crash course with us. These videos will still be worthwhile. Situations can change quickly, and it may be that you can help someone else who is at risk to reduce their risk of pressure damage. Sharing these videos could be the difference between someone avoiding a lot of pain and infection. And that's it for video 1 of the crash course. That's the end. Well done. You have started on your journey toward protecting yourself from a common and painful condition. You've learned exactly what a pressure area is, you've learned how it occurs, and you've managed to assess yourself to see if you are at risk. That's pretty good going for under 10 minutes work. I'll see you in the next one where we'll talk about skin assessment and we'll start to think of those practical skills that you can use to learn how to avoid developing pressure damage. If you'd like to go there now, you can follow this link. Otherwise, just search in YouTube for Crash Course Pressure Ulcers. Thanks for watching. Bye.